I have a little rule of thumb for you. If you have a scientific question like that, you can pretty much bet that scientists somewhere in the world have asked and tried to answer that question. It's kind of what scientists do. We ask questions and answer them for a living.
Well, fantastic. I'm glad you're here to answer my questions, because I do have some questions of a scientific nature.
An absolute tsunami of anti-vaccine misinformation has swept the internet, and Joe Rogan was definitely swept away by it.
Is that a scientific statement? Are we still talking about science, or are we talking about influence?
Even though Joe Rogan has had both reasonable scientists and people who have no idea what they're talking about on his show, he seems to have been completely enamored with the ones who have no idea what they're talking about, including people like Robert Malone and Brett Weinstein, whose conversations with Rogan I've previously debunked on this channel.
Well, if Brett Weinstein doesn't know what he's talking about, and Robert Malone, a critical inventor in this technology, doesn't know what he's talking about, you must be a really smart guy.
But now we've reached a new level with Joe Rogan platforming the biggest anti-vaxxer in the past few decades, Robert F. Kennedy Jr.
So 3 questions off the bat. 1, what website is this? And 2, who took that picture? But 3rd, why are they tracking how censored they've managed to make him online? That's creepy. This doesn't feel like science anymore.
Hey, I'm Dr. Wilson. I'm a PhD molecular biologist, and welcome to another debunking video. Obviously, here I'm going to be going through Robert F. Kennedy Jr.'s discussion with Joe Rogan, covering the relevant anti-vaccine or COVID claims that he made during that conversation, and explaining exactly why they are just wrong. I'll be doing that with peer-reviewed scientific literature and publicly available data, all of which I'm linking in the description below so that you can read them for yourself and not just take my word for it.
Well, fantastic. I'll just take their word for it then.
You will find that all of the anti-vaccine claims that Robert F. Kennedy Jr. makes in his conversation with Rogan have been tirelessly debunked over and over again for many years. But as misinformation recycles itself, scientists and scientific communicators do have a responsibility to address it each time. So that's what I'm going to do here. And with all that said, let's get started.
Well, I'm very glad you have this sense of responsibility to speak with the public in this way and to explain what's going on, especially with technology that's being, in some cases, imposed upon the public without their ability to necessarily read and understand all of this, as you are, inclined to demonstrate repeatedly that no one seems to know what they're talking about. Even respected scientists or people who the layperson might mistakenly believe to be a respected scientist, someone like Brett Weinstein or Dr. Malone. You will have to forgive us for imagining that they were someone who might know what they're talking about. But here you are to have this conversation with the public and illuminate things for us. So we're grateful for that. Although I can't help but feel that we're not on scientific footing. That might lead to questions, but you're here to provide answers, right?
No one is obligated to debate RFK Jr. RFK Jr. knows nothing about science. He knows nothing about vaccines or medicine. These debates have already happened in the scientific literature, at conferences, in lab meetings, at the water cooler in scientific institutions. These debates have happened, the literature is out there, and it's over.
Do you understand that RFK is a presidential candidate? He is a representative, potentially elected representative of the public, i.e., he stands in the place for many hundreds of thousands of people about their concerns about things. If science is not willing to debate someone like RFK to defend their position, who are they willing to debate it in the public eye on questions not of scientific opinion that stays within the water cooler, but affects policy that extends outward beyond the scientific conferences, often at gunpoint. When it comes to mandates and lockdowns and censorship. Who is qualified to debate?
But I have a little rule of thumb for you. If you have a scientific question like that, you can pretty much bet that scientists somewhere in the world have asked and tried to answer that question. In this case, scientists all over the world have already asked and answered that question. It's kind of what scientists do. We ask questions and answer them for a living.
I can see why you guys enjoy doing it. It is fun to take, answers to one question and cut them out and put them in place as if it's an answer to another question. Of course, when Dr. Funk here was talking about scientists answering questions, they're not talking about answering political questions and philosophical questions about who gets to represent the will of the people and what sort of political power science should have over the public in general. However, that is kind of the question that is at hand here. Is there a scientific answer to that question? Because it would be really, really important to know if there was such an answer. Do you have that answer, Dr. Funk?
These debates have already happened in the scientific literature, at conferences, in lab meetings, at the water cooler in scientific institutions. These debates have happened, the literature is out there, and it's over.
I'm not aware of any literature on the application of science in politics at all. One might have questions about the effects of politics on science. Could something corrupt an institution like science? As they say, power corrupts absolutely. Or is it Dr. Funk's position that science is, unlike every other institution known to man, uniquely incorruptible in the face of large quantities of money and power?
It's kind of what scientists do. We ask questions and answer them for a living.
Alright, perhaps that's enough with the fun editing. But Dr. Funk here is speaking with a great deal of authority and finality on these matters. He is condescending, he is teaching us lay folk how science really works. But it's hard to listen to how he answers RFK's concerns about the Vaccine Act and find reason and justification in that authority.
Because what? Because Reagan caved in, and it wasn't just Reagan, it was the Democrats. My uncle was chairing the health committee at that time, and the Democrats also went along. They passed the Vaccine Act in 1986, and the Vaccine Act gave immunity from liability to all vaccine companies for any injury, for negligence. No matter how negligent you are, no matter how reckless your conduct, no matter how toxic the ingredient, how shoddily tested or manufactured the product, no matter how grievous your injury, your vaccine company, you cannot be sued.
Another huge lie. In America, the Vaccine Injury Compensation Program started because many people were believing that their children were being harmed by DTaP vaccines. So many parents believed that their children were being harmed by these vaccines and suing vaccine manufacturers that vaccine manufacturers said, we're not making money off of this, we're just going to stop making these vaccines. So the government actually stepped in and said, no, we need you to keep making these vaccines, so let's figure this out. So the Vaccine Injury Compensation Program essentially was started as a means to have citizens who believe that they were vaccine injured sue and get compensation for their injuries without suing the pharmaceutical companies directly.
That's an extremely long and complicated way of saying that RFK was not lying. Why did you say he was lying when you just demonstrated that he was correct?
But to get to the meat of Kennedy's claim here, nothing in the Vaccine Injury Compensation Program or any relevant law says that vaccine manufacturers are immune from negligence or fraud. They certainly are not. Don't believe me? Well, Kennedy knows that he is lying because he himself has sued Merck multiple times over their HPV vaccine. He is suing vaccine manufacturers because he claims that they are committing fraud and negligence. He's doing what he says isn't allowed.
He didn't say it isn't allowed. He said it can't be done. I hope I don't need to explain that linguistic distinction, but I would ask, why are you changing his words?
Vaccine manufacturers still have to go through all of the regulations set by the FDA. They are beholden to laws that obligate them to make a drug as safe as possible while following all of the required guidelines to make those drugs as safely as possible. They are required to test their drugs for safety and efficacy. If their drugs don't pass those inspections, their drug doesn't make it to market.
Well, we're getting to the heart of things quite quickly. This whole conversation, and by that I mean the conversation between Joe Rogan and RFK, is happening because of COVID. This would not be a thing. Vaccines would not be a thing were it not for COVID as a subject of conversation. And I seem to recall the emergency use authorization permitting COVID vaccinations before they were approved and tested. And wouldn't you know it, that approval was recently rescinded.
The vaccine schedule immediately after they passed the Vaccine Act exploded because all these companies were rushing to get new vaccines onto the schedule. Many of them for diseases that weren't even casually contagious, like ridiculous diseases that are in that, like hepatitis B. Why would you get hepatitis B from sharing needles, or from like going to a really seasoned prostitute, or from sort of compulsive homosexual behavior.
This is such a bizarre claim that shows that Robert has no knowledge or respect for medicine. Hepatitis B is pretty serious. Infections that turn chronic can result in an increased risk of liver cancer or cirrhosis of your liver. And the younger that you get infected by this virus, the more likely you are to have a chronic infection that leads to these things.
Perhaps it is serious, but Robert wasn't talking about the seriousness of the disease. He was talking about it not being casually contagious, which is a pretty significantly different point. Why do you keep changing the subject? Why do you keep not understanding the point correctly? Are you intentionally doing this, or are you not as intelligent as you imagine you are?
Dangling money for scientists to come dance like a puppet for him on his podcast and debate a quack who has absolutely no idea what he is talking about and has been pushing genuinely harmful, science-denying ideas for decades is just such a sad state for the most listened to podcast in the world.
Well, it's been interesting listening to the long presentation about data and peer-reviewed articles and all of this. And indeed, I think the thimerosal argument you advanced, which I haven't included in this, it is worth listening to, was interesting and educational. But having listened to all that a couple times through, I think I can say, just from this concluding segment, that none of what Dr. Funk and people like him have to say is relevant. None of it touches on the heart of people's concerns with vaccines and the medical establishment and with the scientific establishment more generally today. And this skepticism, which once characterized science itself, has now been labeled as anti-science. They're anti-intellectual, they're anti-science, these dirty lay public. And you can hear the contempt and the condescension oozing from Dr. Funk's video, as it does with Dr. Fauci and all these other establishment types. The complaint about contempt is not just moaning about how we're spoken to. It's an epistemological point. The whole purpose of science, because apparently our scientists need this to be explained to them, is about open discussion and investigation. And as Jonathan Rauch says, having no special pleading and no final say. It's about saying anybody, even a lowly postal clerk, might have something to say about physics. And more to the point, opening up the discussion to the broader public, prevents us from being locked in our own narrow views, trapped in our own biases. So is it any wonder that as science has institutionalized itself in the last 20 years, locked itself off from the public and wall the public out from these discussions and water coolers and scientific conferences. That we now have endemic fraud in the academy. That we have a reproducibility crisis in science, including the peer-reviewed studies. All of the data presented by Dr. Funk against Dr. Malone's points is useless to us because of the people doing it. The whole point of science is to expand the people who have access to it in order to take the subjective human element out. By locking out the public, they have undone science, and none of the points they have to say are relevant anymore. Dr. Funk is jealous of Joe Rogan's influence. He talks repeatedly about the reach that Joe Rogan has. And the irony is that Joe Rogan is willing to talk to everybody because he is genuinely curious, which you would think should be the first virtue of a scientist.
These debates have already happened in the scientific literature, at conferences, in lab meetings, at the water cooler in scientific institutions. And it's over.
If we're going to be calling people like Dr. Malone and Dr. Weinstein, people who, have spent a great deal of time in the domain of science, saying they have no idea what they're talking about regarding scientific matters, allow me to join the party. Dr. Funk here, like many advocates for institutional models of science, have no idea what science is. And it shows in their in the weakness of their epistemology. It shows in their certainty. It shows in their closed-mindedness. And it shows in their credulity to anything that is rubber-stamped by the appropriately credentialed institutions. I mean, people like this are why we have a reproducibility crisis and rampant fraud in the academy to begin with. Science is debate. To refuse to debate, or to say, or worse, to say the debate is over.
And it's over.
That nothing could be more antithetical to science as a process than that sentiment, that arrogance. But the process of science is a process of debate. That's not to say it's exactly the kind of debate we would see in, a congressional setting, or in a court of law, or in some high school debate club. But that's not to say that the scientific process is not itself a back and forth between competing theories, with supporting arguments that battle against each other, and we test to see which ones win. And to hear such arrogance from people who can't even characterize their opposition's statements correctly, misunderstand the foundations of their own field so profoundly, and yet at the same time condescend with deep contempt to anybody who has a differing opinion from them, is the reason why science is on the decline. Science has lost a great deal of its legitimacy, and it will continue to lose legitimacy. Perhaps one day science will regain its legitimacy, but certainly not while it refuses to debate or justify its positions to the public or to representatives of the public that it is trying to impose its views upon, and certainly not while it remains married to the state which lies for a living. But of course, people like you will say that we are the ones
who have no idea what they're talking about.
I hate to bring family into this, but it feels relevant. Right after I was married, I was 25, my mother, who happens to be a nurse, suggested that I go get my HPV vaccine. Think about how appalling of a suggestion that is, to tell someone literally within weeks of getting married that you should go get an STD vaccine because you never know what happens. Now, her reasoning that I get it then was because the cutoff for the HPV vaccine is at 26. Did she know why the cutoff is at 26? Well, it turns out it's because 26 is the average age that HPV is no longer a transmissible, a serious risk of infection. Why is that? Well, it's because 26 is the average age that people get married at. I think it's the experience of very many people to be treated in that way, to be treated like a number, and following procedures designed for a statistical population, not an individual person. Now, hopefully your doctor doesn't treat you that way, but the people who give your doctor his best practices, who design the hospital he operates in, who build the medications he is to prescribe, and who create the financial incentives for those prescriptions, do think in that statistical manner, and it's increasingly obvious that they do. Dr. Funk here and people like him have not debunked RFK because they haven't dealt with the underlying suspicion and skepticism that is growing in the United States for science and for the medical industry. And they're not going to get past that through condescension and browbeating with peer-reviewed studies. Because the problem is not with the data. The problem is with who analyzes and presents that data to the public. The problem is with the process. The problem is with the absence of debate. And the problem is with the arrogance and the insularity. The questions and skepticism that people hold toward vaccine is a window into a broader question that people have about science. It's not a scientific question, but a question about science itself. And all of you science advocates who have developed a very deep-seated self-righteousness in your, epistemological strength are going to have to do some real deep searching to ask that question and to learn the real field that asks and answers questions if you're ever going to regain the legitimacy that you have lost in the last 3 years.
It's kind of what scientists do. We ask questions and answer them for a living.
No, that's actually not what scientists do. It is what philosophers do, though it's arguable whether we make a living doing it or not. But in this state of uncertainty about what's true and who to trust and what data is good and what we can take from it and so forth, you can be damn sure that whichever side is the one that is trying to censor, that is trying to deplatform, as you can see by the tracking with RFK's little profile there, who is trying to demonize and get people kicked off of the podcasts of curious people, and who is trying to establish a monopoly on what is allowed to be said in debate, or even with whom one should in good taste be willing to debate. That is someone who is trying to tip the scales. That is someone who has lost their legitimacy in a true scientific exploration of a subject. And you could be damn sure that people are going to push back even without any research, without any data understanding, without having read anything. From that alone, they are going to push back and they are going to disbelieve what you have to say, and they'll be right. And when you appeal to all the lives saved, all the human costs that science can prevent, if only people listen, people will be absolutely justified in distrusting you and disbelieving you if you hold them in contempt.